Thanks a lot, Ember. Now it's time for The Doctor Is In. And this morning we've got Dr. Ira Zunin joining us. He is the director of the Manakai o Malama Integrative Clinic. Good morning, Dr. Z, and thank you so much for joining us.
Thank you.
Now this morning we're talking about alternative medicine and has it gone mainstream? But first thing, let me ask you, what exactly is alternative medicine?
Well, alternative medicine is a word that we really haven't used very much for about 20 years. We now use the term integrative medicine, and it really describes the practice of bringing together the best of modern medicine with traditional healing arts and some cultural practices. If you look in Hawaii, we have 4 licensed professions. They are massage, chiropractic, naturopathy, and acupuncture that have boards and have licensure and in many cases have reimbursement by insurance.
And the Washington Post recently did an article about alternative medicine and has it really been accepted among consumers and is it really going mainstream right now?
Well, the last large-scale government study that came through the CDC, NIH, showed that between 1/3 and 2/3 of all U.S. consumers use these services. We also know from a study in 2005 that in Hawaii these services are used even more, much more, than they are on the U.S. mainland. But as far as doctors go, there's fully 1/3 of U.S. medical schools that participate in an academic consortium, where they just had a very large conference in the Twin Cities with hundreds of research articles, people from all around the world looking at good research.
And probably people here in Hawaii use alternative medicine more because, you know, we are between East and West, right?
Course,
so we look at both modalities, if you could say.
Absolutely.
What is it, in terms of alternative medicine or integrative medicine, what is the most popular, or what has been shown to be the most effective in terms of healing?
Well, those are 2 different questions. You know, you find chiropractic, for example, used in all 50 states. Acupuncture is licensed in most states, but probably the greatest number of studies have been for acupuncture that showed very good benefit, and the largest number of those have been for the benefit of acupuncture for pain, particularly chronic pain.
And also looking at herbs and other, oh look, there's Dan getting the acupuncture as well. Actually, I do acupuncture too, and it really is effective for a lot of different problems. But when you take a look at some of the herbs and other things that you can take, ginger seems to come up all the time for, you know, helping your sore stomach or nausea. Is it really effective?
Well, there was a great study that just came out by the Rochester Medical Center, the largest one that's ever been done to date, showing the benefit of ginger for nausea from chemotherapy for cancer. There's good medicines to stop you from vomiting, but you still have the nausea, and this is a great study. But you're right, the Indian tradition, Chinese, Tibetan, and certainly the Hawaiians have used ginger for thousands of years for all kinds of stomach ailments. Good for motion sickness too.
All right, well, Dr. Z, thank you so much for joining us. We really appreciate it.
Thank you.
And we'll see you a little bit later.